So I'm going to be demonstrating some of the hip Spencer techniques that we can be doing. And so just like the shoulder Spencer techniques, again, the hip is a ball and socket joint, so it really has every single plane of motion that we can put across it. And there's several different ways that I like to kind of work on the hip. And so sometimes we don't really need to kind of do a ton of specific work in a respective motion, but I like to check all those motions when I'm seeing somebody that has chronic hip dysfunction, notably people that have like labral tears, other kind of intra-articular hip pathology that might be going on. And so just starting off, we're going to do a little bit of flexion right over here, and simultaneously we're going to be getting a little bit of a stretch of the hamstring here. So I'm going to make sure that we're just kind of bringing them up whenever I'm stretching that hamstring. I also like to kind of really stretch out the dura, so make sure that I'm really kind of getting some good tension across over here, and just making sure that, and go ahead and push down against me over this way here, and relax. Now, the big thing that I'm trying to do differently than if I'm just stretching the hamstring is I'm trying to feel for the tension, and that might be a little bit more advanced as far as where you feel it, but this is hamstring tension. Right over here is into the hip that I feel that I'm getting down into the hip capsule to work on kind of extension on that back part of the hip capsule. So there's subtle little intricacies that you can do with adjustments. Say, does it feel like it's kind of getting into hip that kind of circles around back over here versus just the hamstring that they're feeling right over here. And so sometimes getting feedback from the patient, does it feel like it's getting more hamstring, or does it feel like it's really stretching that back part of your hip? Okay, so right there, does it feel hamstring or hip?
Hamstring.
Okay, so right over there.
Hip.
Okay, so there we go. All right, so that would be trying to get them bringing up into flexion. If we need to bring them into extension, similar to treating the posterior innominate, I'm going to go ahead and have them grab the opposite side of the table over here. I'm going to get this leg off the table here, but I want to make sure that it's kind of getting to that femoroacetabular joint right over here. So again, you feel like it's stretching that area of the femoroacetabular joint right there. And again, we can do 3 rounds of muscle energy or whatever we need to kind of get that area right over there. So that would be for the extension part. Okay, as far as doing any kind of abduction, adduction. Okay, so for adduction, I'm going to kind of work on their splits a little bit. I'm going to kind of bring their leg out over here. The one thing that's nice is you can just kind of rest their leg on top of your thigh a little bit right over here. And I'll kind of brace on the inside of their knee right over here, just a little bit above their knee, right above the knee, right over here on the posterior thigh. And as I kind of bring them up over here, I'm also looking at their face, making sure that I'm not taking them too far. Okay, should feel like we're getting a good stretch. I'm looking for a stretch of the adductors, but I'm also looking for a stretch of that hip capsule. So do you feel like it's kind of getting in the hip right over in there?
Yes.
Okay, and then I can have you push against me over in here. Now, if I don't hold this right over here, so we're going to exaggerate it here, but if I'm not holding it right over here, I'm just bringing it here, push in really hard. Okay, see how she starts kind of shifting right over here? So if I stabilize this, it ensures she's giving me more right focused at this level right over here. So push in again here, that helps stabilize a little bit more. And sometimes I have like a dancer that's super flexible, and so I have somebody else hold the leg because I'm like way over here. Okay, so that's for the abduction. For adduction, okay, go ahead and scooch back towards the middle a little bit over here. I'm going to go ahead and bring this leg over, bring this leg across a little bit right here. I'm going to brace across that opposite knee, grab it just over the ankle right over here. So just I'm kind of cupping the malleolus, lateral malleolus, and I'm going to be bringing it right over here. So you feel it kind of stretching on that lateral hip.
Yes.
And this is really good for getting the TFL and the IT a little bit as well. Okay, so go ahead and try to push back towards the middle here while I'm kind of bracing across over here. And again, I can do a series of 3 of these, relax, and then take it a little bit further to stretch over there. So that's for adduction. Now, as far as for internal, external rotation, if I'm coming up over here and I start kind of trying to bring them into some internal rotation, very often you can feel the capsule right over here that needs to kind of be worked on. Okay, do you feel like that's getting into the hip right there? And this looks similar to the Freiberg's test that we'll do on the hip. Okay, and so I can say go ahead and I want you to try to kind of push your ankle against me this way right here. Okay, so we're trying to get her to externally rotate against us so I can get a little bit more internal rotation, relax. And when she relaxes, I'm going to take it a little further into internal rotation. Now I can do it from different angles where I'm kind of taking it from right here. Okay, and this tends to get the piriformis a little bit more and some of the gluteal muscles as it's, we change the vector. And so coming from right here, go ahead and try to push back towards the middle there. Feel a little bit different, a little bit more into the buttock than into the hip, but still good to kind of work on from that angle. Sometimes I will also try to kind of bring them across like this right here and go and push out against me this way here. Relax just to kind of get the abductors from a slightly different angle as well. Okay, as far as working on external rotation, I can bring them out over here. And again, sometimes I like to kind of, have a cross right over here so they can kind of push into me. I just have better leverage, so go ahead and push out or try to kick out that way. And sometimes you have to show them which way to go and relax. And then I can take them a little bit further over here. And then sometimes I can do it from a Patrick's kind of position right over here. Again, you want to kind of line it up so that vector is going into the hip. Go ahead and try to lift your leg up right over here. You feel it going into the hip?
Yes.
And relax. And then I can take it down, relax, relax, relax. And I can take it down a little bit further right over here. Okay. The compression and traction with circumduction, I feel like is an overlooked kind of component of the Spencer technique for both the shoulder, definitely for the hip. And I feel like it's really imperative. Think about the hip joint like a mortar, and we're kind of trying to put something in there. We're trying to break up any scar tissue that's deep within that mortar. And so that's where it's really important to make sure that we're trying to grind up any of that scar tissue, any of those adhesions that maybe have developed because of irritation, inflammation, injury, anything like that that's happened. And so when I'm bringing up, I'm trying to push my vector right down into this spot here. Okay, so I'm gonna be continuing the compression with circumduction part of the Spencer technique right over here. So I wanna make sure, again, I'm getting a vector directly into the femoroacetabular joint. So when I'm bringing up, I'm kind of trying to put that force through the knee. Sometimes it hurts if they have patellofemoral kind of issues. So if that is kind of bothering them, I try to get that feedback. Then I can try to put my force vector through their femur instead, just by kind of leaning over here, leaning my body into it. But I find I can fine tune it a little bit more if I can kind of have my hand over the patella right over here. So as I'm doing that, I'm kind of directing it there, and then I'm just kind of bringing it through range of motion right over here. You okay with that?
Yeah.
And you should feel like it's kind of going deep within the hip. And I'll start with small little circles, and I'll kind of work into bigger circles, and I check all the different areas that I might need to kind of get. And then I'll start clockwise, and then I'll move into a counterclockwise kind of direction, working through that. And if I feel like I catch something, I feel like I need to kind of just grind that little kind of thing out, I'll just kind of start small, and I'll slowly kind of work bigger over there. Now, once I'm trying to do the traction and circumduction, the little trick I've come up with is, again, using levers. I'm a big lever person, so I need a stool because my table doesn't adjust. I'm gonna hang on to the table so you don't feel like I'm pulling you off of the table. I'm gonna bring the leg up, I'm gonna bring my arm through, I'm gonna put one hand on the thigh, other hand right here, so I kind of lock that down right here. And then when this is right here, if I just stand up, now I'm kind of gapping the hip. And so as I gap the hip, now I can do this over here, and I can take it through clockwise, and I did counterclockwise. Start small, move into bigger circles. And I find this one right here really helps people that are having hip kind of issues, notably like people that have labral tears. Takes that tension off of that area. Very often there's some fibrous adhesions that are starting to develop because of the labral tear. And so, we're not fixing the labral tear, but we're making the dysfunction that occurs around it feel better. And so thinking about that mortar that we were talking about grinding out, it's not really the one at the bottom. We're talking about stuff on the sides that I'm trying to kind of target with that. So anything on the side of that mortar over there, that's where I'm trying to kind of grind that out. All right, and so let me see here. We've done flexion, we've done extension, internal, external rotation, adduction, abduction. What else do we do? So the last thing that we learned with the hip spen or with the shoulder Spencer is doing the pump. So how can we do the pump on the hip? So when I bring you up over here, okay, now granted, I can't totally get on the inside of the femoroacetabular joint as much as I can on the shoulder. I don't want to be invasive in the entire groin region right over here, but I'm trying to have a pump-like siphoning kind of motion after I've done all this other stuff. Just like on the shoulder, I like to kind of actually have it so that this lays between my head and my neck right over here, so I can just get a little bit of a lift just like that alone, but then I'm going to be using the thigh. Okay, and it's like a pump-like motion that we're doing there. Making sure I don't feel like I'm pulling her off the table. And again, looking at faces, but that's the last part I do on the hip Spencer.